Hello everyone, welcome to the Statistical Society of Australia's April webinar. We're so glad you could join us. I'm Susanna Cramer, I'm your chair for today. So first we're going to have the talk, followed by questions. So you're welcome to type your questions into the chat window at any time throughout the presentation, and I'll read these out to our speakers in question time. Following question time, there will be an opportunity to briefly meet and mingle with other people in small breakout rooms, and Mark will randomly allocate you to those should you choose to take up that opportunity. So we're delighted to have Nick Fisher and Dennis Trewin speaking today. They are both renowned statisticians and also both are past presidents of the Society. So Nick will speak first, followed by Dennis. So over to you, Nick.
Thank you, Susanna. W. Edwards Deming used to remark that a statistician needed to be the number 3 person in a company. It took me a long time to understand why that was the case. But now we're confronted with a situation or a project where we definitely feel that appropriately skilled statisticians need to be in the C-suite. So the basic message of this presentation is that clear, disinterested, informed and reasonable professional statistical advice needs to be resonating at the highest level of governments around the world in response to this crisis. So what we want to talk about are these points. We won't be talking all that long, but there are a few points to cover. First of all, how did we, Dennis and I, get involved in this? Apparent origins of COVID-19, what's going on, what's been going on elsewhere in the world. What are some of the things that we really do need to know about, but simply don't know about? Thank you, Dick Cheney, for popularising this little term, known unknowns. Then, what we recommend as a statistical response to addressing item 4. A few comments about what's been going on elsewhere, and then over to you. So, a short while ago, Dennis and I published a letter in the Australian and a similar letter in the Australian Financial Review, as a consequence of which the Australian Financial Review asked us to write an opinion piece about what we said was an urgent need for high quality national survey data to be informing the government's actions. And that opinion piece has since been disseminated quite widely. What are the apparent origins of COVID-19? Well, there are the 2 big questions. The answer to the first appears to be from bats to pangolins to people through wet markets. People seem to be under the impression that wet market is a pejorative term. It's actually not supposed to be a pejorative term. Wet markets are all over the world, especially and not least in our own country. As to when this occurred, we will have a few comments to make later. What's been going on around the world? Well, there have been a range of crisis management strategies adopted, from war cabinets to what one might call HITs. Where HIT stands for head in the sand. For example, in Indonesia, the leader said, well, we're going to rely on prayer, we're not going to go out testing. And in Brazil, the leader is saying that Brazilians are strong people and can muscle it out. Obviously, there have been restrictions on movements, lockdowns, closure of many non-essential business activities and sporting activities, all sorts of research. Little groups, or not so little groups around the world, are developing complex epidemiological models to understand the development and movement of the virus. There's increasingly widespread testing and tracing going on, in particular a rather humorous graph that appeared today. If you go to the Johns Hopkins site and look at France, you see that today registered a negative, yesterday there were a negative change in the number of cases reported. And then a lot of medical facilities being boosted. And then, of course, there's acquisition of data, now, which is what we're concerned about. In terms of understanding what sort of data might need to be acquired, apart from what the data that are being acquired, it helps to think a little bit about the planning that is required now and in the future. So at present, there are 4 stages here. The current stage is we're trying to manage to avoid overwhelming the health system. The term that's in current use that people seem to understand, at least in terms of what it does to a curve, is flattening the curve. Whether they quite understand the point of flattening the curve, I'm not sure, but at least they understand that we're trying to change a curve. In the transition phase, which we're moving into, or some countries are moving into, the restrictions are being gradually eased. So schools are returning soon in Denmark and Norway, and in Italy and Spain, there's a gentle, somewhat managed return to business, shops are opening, and so on. The third phase will be a post-quarantine phase where the primary requirement is to make sure that a second wave does not overwhelm the health system after the relaxation of confinement and so on and so forth. And then the final stage, post-pandemic, when vaccines are available and economies are being put back together, they're going to be restructured rather differently. For example, in Australia, there'll be a whole host of things that may be quite different, not least the numbers of international students, international tourism, where people choose to live in retirement, and so on and so forth. So those are the different stages in which we need to be thinking about what sort of data are needed. What is going on at the moment, at least in Australia, has been, for the most part, observational. Much of the data derived from things like how many people are infected, how many deaths have there been, how many people have recovered. And these data are okay for managing the first stage being the current stage, but they're quite unsatisfactory for the following stages. So what do we need to know as a matter of urgency? Here are what we regard as some of the known unknowns. Sound data are essential to being able to estimate a number of quantities that are input to decision making, and particularly in the building of models that will predict what's likely to happen. So here are 7 numbers that we don't know. How many people haven't contracted the virus in Australia, have it but are asymptomatic, have the symptoms but haven't been tested, are currently suffering, have had the virus and have recovered then been reinfected, and an infected person is likely to reinfect, but how many people is that person likely to reinfect? So not only do we want to know those numbers, but we also want to know and need to know how those numbers are changing with time, and also how they change according to other interesting covariates. The unfortunate fact is that governments all around the world are largely flying blind in relation to the answers to all of those questions. Yet the data are essential in enabling governments to gain a better understanding of what is driving community transmission and the possibility of a second wave. And it's the possibility of a second wave which is really causing a lot of concern. So what needs to be done? Well, we know there's definite evidence in Australia of flattening of the curve at very considerable cost. What is needed, in our view, is a scientifically valid plan to return to some form of normalcy, whatever that might be post the epidemic, that guards against the possibility of relapsing. And so that plan has to be informed by a complex model. It's not of necessity, it's complex, and it's largely epidemiological to forecast how the epidemic is likely to change, particularly in Australia. And that will depend on the quality of the data supplied to the model. So at this point, I'll hand over to Dennis.
Right, well, thank you, Nick. Our suggested response is that we should implement an efficient weekly sampling random process of the Australian population, which includes testing of individuals to identify which of the categories Nick mentioned that they actually fell into. You would also, as part of this sampling process, need to collect some other relevant information, not just demographic information, but information on risk factors, morbidity, and so forth. And this is nothing new. We've been using sampling methods in Australia since the 1950s, and in the US even earlier than that. So it's not as if we're inventing a method that's completely new. We also think that the skilled application of statistical science is essential to making progress with management of COVID-19. The epidemiologists have been very heavily involved so far and have done a fine job. But I think it's now time that there's much more of a partnership than what there has been in the past, particularly on areas like data collection and analysis of data from sample surveys, which many of you will know is not perfect, and it does require some special techniques and methods in order to get good estimates from sample data, which may suffer from things like non-response, measurement error, and the like. It was interesting that Paul Kelly, I think it was on Easter Monday, in his media conference, said he talked about the unknowns, such as how widespread is the virus, what level of immunity has occurred, how many are asymptomatic or not even bothered to be tested, although they may have symptoms. So he is arguing that this is information that we need to know. No, he didn't go on to suggest a sample survey. So next slide, thanks, Nick. The ABS has a lot of the required knowledge and experience and capability for the design and collection of demographic and socioeconomic data. And I've had some contact with them over the last week, and they're quite keen to be involved. If they're asked, they're quite willing to actually be involved. But obviously they can't do the actual testing, so a research partner would be needed to do this. A lot of information that you need to properly analyse these tests, the ABS can actually collect through its telephone serving capability. And this would include the informed consent to go on and have a test undertaken. Legal, it's already quite legal to test randomly for alcohol or drugs, so I don't think there'd be any legal issues here. But as I just mentioned, I think informed consent would be a very wise thing to do. We need to use testing procedures that are highly accurate in terms of producing a correct analysis of those who are unexposed or exposed to the virus. To be able to classify according to those, I think it was 7 groups that Nick mentioned earlier, and this is not straightforward. We need tests that give a relatively small number of false positives and false negatives, and this has to be properly analysed, and we maybe have to reduce our ambitions on the number of different classes that we can separate. But we certainly want to be able to measure the main groups, those who actually either have a virus or have the antibodies and so forth. Now, to do this, you need an expert team that comprises both statisticians and epidemiologists. Epidemiologists are the subject matter experts in this occasion, so they're the ones who know what type of information is important and need to work with the statisticians in order to design a good questionnaire, for example. And they also would have significant input into what is a good sampling scheme. So we think speed is the essence here. The sooner we get this launched, the better. And every day's delay incurs very, very considerable economic, social, and social cohesion costs. Next slide, thanks, Nick. So the process we're suggesting should provide sound information about the different levels of each category of exposure to COVID-19 for the various socioeconomic groups and the rates of spreads for these groups. We should also be able to classify according to risk factors and also morbidity conditions as well to support that type of analysis. It would be provide a sound basis for judging when it might be feasible to start relaxing the current restrictions. And also, importantly, a means of monitoring what happens after this occurs, whether there is a substantial risk of a second wave. Although a lower order of priority than the first two, it has been suggested that maybe the COVID-19 existed in Australia prior to arrival of Wuhan from the first known case. And this hypothesis has been put forward in other countries, such as Stanford in the US and also South Korea. So this data, combined with using epidemiological models, which look at things retrospectively, would give us some insight into whether it happened earlier than what we currently think, and maybe there is a level of herd immunity in the Australian population. Next slide. What would the design look like? I have been collaborating with Norway, where my daughter lives, and interestingly, they're starting to run a national sample, and they've got a very similar sort of overall design to what we're proposing here. So every three high-level strata, one is the existing testing regime, that is the targeted testing. So there's no data collection involved there, that's already happening. Secondly, there's persons at higher risk because of their job. And this would include medical and health workers, I guess teachers if students go back in significant numbers, and even areas like supermarkets, which have got a lot of face-to-face contact with the population, may be at more at risk. Now, the ABS does run a survey of employers called the Survey Employee Earnings of Hours, where they actually get a sample of employees by selecting employers. So this again is a proven methodology. And there's also the possibility of a random probability sample of the Australian population. This would be stratified. It would be clustered to make the actual testing easier, and so forth. So it's not just a straight simple random sample across the Australian population. It would be designed to be efficient, but still give you the information that you need. This is a multi-frame approach, so some people will have multiple chance of selection. So in estimation, you'd have to allow for that. And it's not too hard to ask persons in groups 2 or 3 whether they've actually already been tested, and so you can eliminate them from the sample if that is the case. We're also arguing that this is continuous sampling because trends are important to measure, but a large initial sample would be in order. So next slide, please. Well, what's going on here and elsewhere? First of all, the ABS. I should say up front, I think from what I can gather, the ABS has been more involved than any other national statistical office in the world. All the other cases I will mention below, the study has been mainly undertaken by organisations other than the National Statistics Office. But the ABS has been running surveys of businesses to understand the impact. the virus on them, and particularly the restrictions. It's been running surveys of households to also understand the impacts on households, income, employment and so forth. And it plans to keep running these surveys on a regular basis until they're no longer required. It's also been releasing a number of key statistics a bit earlier than what it might, and doing some special analysis. So it's been very active in what it's doing, and it is actually involved at a higher, with Prime Minister and Cabinet at a fairly high level. So the ABS is definitely closely involved. In Germany, they're about to commence, I think at the end of the month, a very large survey, I think about 100,000, and it is aimed to get information on the prevalence of COVID-19 in the population, and in particular, there's a strong emphasis on the number of people who already have antibodies. New Zealand, it's been generally accepted that a national survey is a good idea, and this did require quite a few arguments between the statisticians and epidemiologists. It wasn't that the epidemiologists said, "Great idea, let's get on with it." It took a lot of convincing, but there's no definite plans to do it at present because there's not much spare testing capacity in New Zealand, or at the time we wrote this, and they want to put their testing, they want to focus their testing capability on the population who's most at risk. In Iceland, a private genetic research company known as Geocode actually ran a survey. When I looked, they've already had a paper published in the New England Journal of Medicine if you're interested. You can pick flaws in their data collection. They had a fairly high non-response rate, for example, 66%. But if you believe the results, they show that the population prevalence of COVID-19 was actually quite low, around about the 0.6 to 0.8%. And I think that was lower than what they were expecting. The Norwegian Public Health Authority, it's got the initials FHI, is about to commence testing on a randomised sample. And as I mentioned before, the approach they're using is quite similar to what we suggested on an earlier slide. And there's a number of countries who have run studies aiming at learning about issues such as the presence of antibodies, reinfection rates in specific groups. So there is a lot of work going on out there, and it probably would be worthwhile doing some meta-analysis of what various people are finding. Next slide, please. Nick mentioned the fourth stage, that is after either a vaccine's been successfully put in place, or for other reasons the virus has run out of steam. We will have a very different world. Our economy will be quite different, and I think people's behaviour will be quite different. Nick mentioned some of these things. The tourism, for example, there'll be much more emphasis on domestic tourism and less on international. There may be internal migration. I know, I live on the Mornington Peninsula down in Melbourne, and there's been a rush of people coming down here to their holiday homes and spending the quarantine period down here. Also, unlike most other parts of Australia, the demand for housing has actually increased. Also, retail will be quite different. People would have got used to shopping online and found it's not all that difficult and it's convenient. So I think our retail sector will be quite different after we come through this than what it was when we went into it. More people work from home, and that will change the demand for office space. It will increase the demand for strong communication facilities and so forth. And we'll expect for things that are regarded as vital, like toilet paper, that we may even have more Australian-based production. Also, what is going to be the situation with international students? on one hand, you may think the numbers may go down as people are more concerned about travel, but on the other hand, particularly as the US is seen as a riskier environment, and there's more, they're the ones that capture most of the international students. There may be more coming to Australia. But there also may be more people who actually want to get a degree from an Australian tertiary institution but want to stay at home. So more demand for online facilities. So there's a whole lot of things that could happen, and we need to rethink about the types of statistics that we might need in the future. And I've just mentioned a few there. There's surveys of business and household finances to actually understand how quickly people can actually snap back to a more normal existence. We need to know about plans and expectations. And also, I've already mentioned the third one, but the last one, input-output tables are a tool that's used to actually understand the second-order effects of increases and decreases in certain industries, and they would be very valuable for actually understanding the impact on the Australian economy. So next slide, please. You've gone the wrong way. Right, okay. Well, just to summarise, Australia needs to act now, we believe, along the lines of the implementation program we've talked about. We also think that appropriately skilled professional statisticians need to be involved at the highest level of decision making in relation to how such a program is designed and deployed. There are statisticians involved at present, but they're more your biometricians, people used to analysing epidemiological data, and they're important, of course, but they're generally limited in their ability to institute data collections. In fact, as part of the email exchange we've had with various people, we've been a little bit surprised that the sort of data collections that epidemiologicals look at are somewhat restricted. They tend not to think of national samples as a way of collecting data that might be useful for them. So there is a very real opportunity for the statistical profession to give prominent demonstration of important contributions it can make to what is the most important issue facing our country at present. So I'll finish there, and it's now time for questions and comments.
Thank you so much, Nick and Dennis. That was outstanding. So people, you're welcome to type your questions into the window now. We do already have a question from Ian Westbrook. So does New Zealand's elimination strategy have implications for population survey needs?
So is that question for me?
Nick is nodding. So yes, sorry, would you like me to repeat that, Dennis?
Yes, please. Sorry, I couldn't. I have to turn the light on. Having trouble.
No. Does New Zealand's elimination strategy have implications for population survey needs?
Well, it limits the type of data collection methods you can use, but well, certainly in Australia, I think it's true in New Zealand, telephone surveys are used quite extensively. So we're suggesting that the non-testing information be collected by telephone. But obviously you would require field operations to collect the testing data. I guess there's two ways of doing this, or perhaps a combination. In Germany, they've got what they're calling yellow taxis going around with medical staff actually going to the households to undertake the testing. And the households would be clustered, of course, to make that a bit more convenient. The other method which was used in Iceland was to actually get people to go to the testing station, but not surprisingly, they didn't get us a good response to that. People had to make an effort than what I expected the Germans will get.
Thank you. We have a flood of questions coming in now. So from Adrian Barnett, for either Nick or Dennis, do you have a ballpark sample size for a national sample?
No, I haven't actually gone into that. I think if we talk about daily sample, I would think we're talking about hundreds, maybe as many as 500. We're not talking about thousands with a daily sample. The initial sample would be much larger. Germany's using a survey of 100,000, which I think, that's impractical. But what we're trying to find out is the number who are infected fairly small. We're trying to make sure it doesn't go above a certain level where it gets hard to contain the virus. So if that's your goal, rather than getting a precise estimate of what proportion of the population infected, you can get away with a smaller sample than what you otherwise might.
Great. Do you have anything to add, Nick?
Yes, the reason for the large initial sample is to give some insight into what sample sizes might be needed on an ongoing basis.
Sure. So from Tim Brown, so there's some doubt about the sensitivity of the current test. Do you have any ideas about how to correct for this?
The sensitivity of the test for COVID-19?
Yeah.
Well, the short answer is no. But normally when you're analysing survey data, it's imperfect. There's areas of uncertainty, and this would be another one where there's a possibility of a false positive or a possibility of false negative. So, it's a form of measurement error. So you would have to take that into account in your analysis. You definitely should try to do some, and this would be a parallel activity, some more intense experimentation to try and find out what the degree of false positives and false negatives are. But once you go into the field, you've got to accept the tests as they are. But it's important to have knowledge on how accurate they actually are. I don't know if you want to add anything, Nick.
I haven't got much to add. There are a lot of small focused research projects going on all around the world exploring very specific issues, and there'll be subtleties about how these false positives and so on actually, what sort of covariates are important in understanding that and so on and so forth. I really don't know, and I think it's a challenge at the moment for the medical community to be coming up with a really reliable test. I'm not quite sure what the status of that is yet.
Nick, in one of his slides, indicated the 7 unknowns we really would like to know. If the tests aren't sufficiently accurate, we may have to reduce our efficiency and focus on the main categories.
Okay, so the focus, this is a question from John. The focus is quite rightly on infection status, but the social distancing controls that might or might not be relaxed soon are largely unmeasured. How do we measure the changes in social interactions and then the effect of controls?
In a sense, this is an issue for epidemiologists. Why they have to work together with statisticians. One of the things that's very important for the epidemiological models is the reproduction coefficient. I think that's mentioned on the bottom of the slide, but I can see anyway, I hope others can. In the early days of the virus in Australia, I believe that was around about 2.5. It's now well below 1. And that being below 1 seems to be it seems to be the strong goal. If it's above 1, you're in trouble in terms of trying to control infection. If it's below 1, you've got much more. So I think what the epidemiologists need to know is what is that reproduction coefficient now, and is it changing as they release restrictions? How much is that changing? That would be one of the key things to be able to measure accurately. At present, they can hypothesise. If they know what the base number is, they can, based on knowledge they've gained from other countries and the like, they can actually hypothesise how that might change as different restrictions are lifted. But yeah, as I said, that's one of the things one of the most important change variables we should be measuring on how it's changing over time as the environment that we're operating in changes.
Question from Jeff. Do you have any thoughts about the need for geographic distributional data, such as small area estimates?
I think it's going to be very hard to get detailed geographical data from a national survey. I think you're going to have to rely on your tests of the at-risk population there, and they are doing that. They're capturing local government area. They know that Waverley in Sydney, for example, is a place where there's high prevalence. So I think there is a need for that type of information, but the national sample is not the answer. It's your more it's your current testing regime that's going to identify the hotspots.
Do you think there's any, this is from Michael Stewart, do you think there's potentially any benefit for in either efficiency or cost in coordinating design or etc. with other countries such as New Zealand?
Certainly working together with our colleagues from across the ditch is well worthwhile. In fact, probably those who are listening, it probably doesn't surprise them that Len Cook and I have been in 2 or 3 times a week contact over the last 2 or 3 weeks. And also at present, I know ABS and Statistics New Zealand are in regular contact. So that would be well worthwhile, that sort of cooperation. But when you go, you talk about cooperation with other countries like European countries or US, their systems are just so different. They're also at different stages of controlling the virus. So we can pick up ideas from their experiences and what's worked for them, what hasn't worked, but actually trying to collaborate with a consistent approach, I think, would be a waste of time.
Sure. So from Louise Ryan. Great presentation, thanks. There's been discussion in the news lately about the government-funded phone app that will supposedly be able to help track people. Do you think this could be linked in with some kind of survey? She's had people express concerns about privacy, but perhaps this might be allayed if connected to the national sampling scheme.
I didn't quite, can you repeat the first part of the question?
Sure, so it's talking about the government-funded phone app to help track people.
Oh, yep. Right. I haven't thought about that one. Well, in a sense, it depends on what the take-up rate is. They talk about 40%. I would have hoped it would have been higher than that. But the Iceland study I mentioned before, that used mobile phone apps to try and get their sample. They only got 34% take-up rate, and I would have thought that Iceland's not a well, it's different to Australia, I guess, but I mean in terms of a strong sense of community, it would be similar to Australia. So that would be the thing that would worry me, whether you would get a representative sample. Because Iceland also has the benefit of having all those population registers, so that they've got more information to enable them to adjust for any imbalances in the sample. We don't have quite that type of information. So I think if you just relied on the app, I think what you would get would be a sample that's biased towards a better educated, so you may not get answers that are completely representative, but it's certainly worth looking at.
Anything to add, Nick?
Well, I would have said very much what Dennis said, except that I disagree with the uptake. I think the uptake will be greater with young people who don't mind being tracked as much as some older people who are deeply suspicious of things like this.
Thank you.
Anyway, I don't know. I simply don't know. I'd be skeptical about the uptake, quite frankly.
I know with Iceland, a lot more females than males took up their particular application.
Interesting.
I guess I'd be interested in whether Louise herself would be prepared to use the app on her phone, so that people knew where she was and what she was doing.
So another question from Lauren Winterborg. What can we, as Australian statisticians, do to help make this happen?
As a former Australian.
What can we do as Australian statisticians to help make this happen?
Look, I've been in contact with David Trewin, a new Australian statistician, on several occasions. He embraces the idea and said the ABS is willing to implement it if they get the go ahead from government. So the ABS is certainly not a stumbling block here. It's convincing those who are at the most senior levels in the COVID-19 response, but this is a worthwhile exercise.
Yeah, but I think even just more for the audience listening, many who are statisticians, yeah, what can we personally do to assist in making this happen?
Do you want to answer that one, Nick?
Well, I was asked this question by a friend a short while ago. Basically, he said to me, what else are you going to do? And at the moment, I'm not sure, because we know that the article the opinion piece we wrote has been communicated to the top level committee in the country. And we don't want to alienate those people. We really want them to take notice of it. So whatever is done has to be done in a way that's supportive of making sure they pay attention to it, and anybody's opinion about how to do that are equally valid. I have no special thoughts anymore. Yes, you can write more letters to newspapers, or you can talk to local members and so on. I don't know. I feel embarrassed that I can't think of some constructive further step that, for example, Dennis and I could take. If people have ideas, great, let's hear them. I'd be really interested. Maybe in the chat room, we can talk about that.
As Nick said, the National Coordination, Coronavirus Coordination Committee, which is the very high level body advising the National Cabinet, they've had this passed on to them from two sources. One, the deputy chair of the committee, who Nick actually swims with, I think, occasionally, and David Trewin, the Australian statistician, passed on as well. So it's on their radar. Whether they accept it or not, we'll find out. But I think it was interesting that Paul Kelly, I mentioned in my talk, that he talked about the unknowns, including many of the categories that Nick and I have chosen. So I don't know whether he was influenced by what we wrote or not, or whether he was thinking independently. So I suspect it's getting some attention from government at present, and we've got to give him a little bit of time to react.
Great. A question for both of you from David White. What are the implications for other viruses and controls, such as measles, tuberculosis, or AIDS? Can the statistical models being used help to reduce the spread of these other diseases?
That's a question, I think, for an epidemiologist. I mean, those diseases are basically living on in the community all the time. Whether one needs a national survey to manage what's going on there, I don't know. Maybe there is some value in an ongoing survey for other, but those sorts of things are usually picked up through medical practices. Many years ago, my father was head of epidemiology in New South Wales, and he instituted, and I'm talking decades ago, 3 or 4 decades ago, he would had a weekly newsletter going out to country doctors saying, this is the information we've got back from other practices about what's coming through their area, and please let us know what's going on in your area. So this is a two-way communication that gave people around practices around the New South Wales an idea of the movement of these viruses. Now, I believe there are vastly more sophisticated versions of that process already going. So I think there is quite a bit of epidemiological knowledge about how these things are moving around in the community. Whether or not one needs more than that in the light of what we're proposing here, I don't know.
I wouldn't be suggesting a national samples or national survey is the answer to those sorts of questions. That epidemiologists have a number of different approaches to try and estimate the prevalence. Nick alluded to some of them, and but they're not on a scale we're talking about here. That's why I think on this occasion the national samples is part of the answer to actually understanding what the situation is in Australia, and also the costs are much more extensive than what they are for measles is important, obviously, particularly for the family of those who contact it. But here we're talking about huge economic impacts, huge social impacts. So getting the right solution at the right time has got great benefits.
Bear in mind what's involved here, that when you choose somebody at random, somebody actually has to go out and test them if they haven't already had something. So it's a little bit invasive, and to be randomly testing people to see if they've got measles, I think would not be a popular move. It would be a courageous Prime Minister who would attempt that.
Thank you. So a question from Angie Robinson for either of you. Thanks for the presentation. Would you contemplate sampling with partial replacement as a way to more efficiently estimate the growth of the infected portion of the population?
Sampling with partial replacement. I'm not quite sure exactly what's that meant by that. I assume it means that rather than sampling the same people all the time, that there'd be some rules for replacing some of the people in the sample. But that's that would be a detailed design issue that I haven't tried to put my head around today. But we are trying to move trends, measure trends. So you get better measures of trends if the same people in the sample continuously. But if you do that, you're going to get fatigue from responding, so you need to get a balance. So that's one aspect of the design that we would have. Or the people who run, suggesting Nick and I run the survey would be run by others, hopefully the ABS. And they've got people who are experts in design who could work through those things.
I'd be there may well be two parallel surveys running, one of which is getting new people in all the time, another of which is tracking existing people. I don't know. It's up. That's a big detail of the design.
So you mentioned in your talk a few different categories, and one person's asking if they could add a further category for people to sample from, which is persons or locations important to community transmission, such as Flemington Produce Market, maybe a location encouraging transmission to the workers and from them to the food supplies in the community at large. Do you have any comments on that?
One of the highlights Shire identified was those at risk through their employment. I was suggesting that you access them through a sample of employers, but there are other ways of doing it along the lines that the questioner was suggesting. And I think in some countries, I can't remember where, that actually is part of their national testing regime, is to actually focus a sample on things like markets and so forth.
A question from Teresa Neiman. Can you talk more about the potential privacy issues? For example, an older person in a high contact position may worry about losing their job in case they're tested as susceptible. Could this be a basis for not keeping the person in their job? What about in industries where they're looking for good reasons to drop employees because of budget constraints?
Well, on the first one, I don't think somebody should be protected just because they're in a high position. If they're in a high position and they've got the virus, it shouldn't be a secret. People need to know. Everybody else needs to know about that. So the fact that they've been tested can be confidential, but the outcome of that, if it's that they've had contact with the virus, shouldn't be confidential.
Well, I don't think you should be blurting out publicly. XYZ's got the virus, but people will be able to find out through the tracing, because this is it's one of the important strategies here is once they find positive cases to actually trace who they've had contact with recently. And from what you can see around the world, countries like South Korea and what, this has been a very important part of the response is the tracing, and that's one of the things that Australia's actually been strong on as well.
I'm sorry, I didn't mean positive cases. I mean susceptible, like you don't have the antibodies.
Right. Was that a comment or a question?
No, that was my comment. You read susceptible as being positive for the virus, but I intended that you simply don't have antibodies, not that you're positive, but you become not that you're at risk, that you put other people at risk, but people could make an excuse in saying that you are at risk, and therefore you lose your job. Not because you have the virus, but because that they want to protect you.
Yeah, I think you're drawing a fairly long straw, to be honest. Yeah, some things are. Privacy is important, but we're talking about trade-offs here, and I think if we're serious about tackling this, we have to trade off some of the normal privacy protocols that we have. Actually, this morning read a piece from Canada that was actually arguing the same thing. That, and I think also some of our New Zealand listeners may be able to comment here, but I think the New Zealand Privacy Commissioner has actually come out and said that in this situation we have to not be quite as strict about our privacy considerations as what we normally would be.
Great. Question from Bill Whiten. The virus is appearing in isolated clusters, giving long tails. How does this affect sampling?
Do you want to answer that, Nick? It's over 40 years since I was a methodologist, so my knowledge has got a bit rusty in some of those areas.
What's the significance of the long tails?
Bill, you're welcome to unmute if you'd like to clarify your question.
What do you mean by the long tail?
So has a systems, well, it might actually be a separate question. Bill also asked if a systems approach had been considered, such as a delay difference equation and Kalman filter, but I believe that's a bit separate to the long tail. If you'd prefer to answer that question, go for it.
Well, considered by whom? By the current experts advising the government, or by the people building epidemiological models, or by whom? Not by us. That is the first time the term Kalman filter has been used in a conversation involving Dennis and me. I'm sorry, that's not very constructive, but I think these are modelling issues that will come up when the sampling scheme is designed, because there'll be real statistical expertise required to be brought to bear to modelling and analysing the data that come out. It won't be a straightforward exercise.
Great. So there's still heaps of questions, but I think for time's sake, I'll just ask one final question from Kerry Mangerson, and then we'll allow people to mingle in small rooms and discuss more. So could you envisage a plan that enlists accredited members of the Statistical Society of Australia to undertake microsurveys in their area? Could this speed up the process?
I'm sorry, can you just say the last bit, please?
Sure. Could this speed up the process? So doing microsurveys in separate areas by accredited statisticians?
I'm not quite sure exactly what's meant, but I think you'd have to be careful about representation. Yeah, because accredited statisticians are going to be, they're more likely to live in the metropolitan areas. They've probably got higher than average income, so even within the metropolitan areas, you're probably going to have a bias towards sampling from middle and upper class suburbs. So I'd be a bit worried about that without looking at the proposal in detail. I may have misunderstood it, but that was my first reaction.
I think it's an interesting speculation, Kerry, but I don't think it's practicable, because you then have to find the resources to carry out the tests. Once you've identified whom you wish to sample, who's going to do the testing? It can't be, accredited statisticians aren't necessarily accredited to put a needle in somebody's arm and draw some blood.
Great. So we will send you both a copy of the logs. You'll see all of the other questions that were not able to be addressed in this session, but there's been great participation here. I really appreciate everyone who's given questions, and I'm sorry if we didn't get a chance to answer your question directly. I do want to thank Nick and Dennis again for an outstanding presentation. Thank you for your time. We really appreciate it, especially when things are so busy at the moment. I also want to thank Mark Visht for brilliant technical support behind the scenes as always. So our speakers will also be participating in the mingling time, so you could be allocated to a room with them. For anyone who can't stay, enjoy the rest of your day, and I'll hand over to Mark to give some details in the breakout rooms. Thank you so much.